Sego, Scano. Hello, everyone. This is Lori Davis Hill, Incident Command for the Pandemic Response on Six Nations of the Grand River Territory. We took a break over the month of August, but we're now back on a weekly basis. Are you ready? I am. This is your COVID-19 podcast for the week of September 8th, 2020. It all begins at the wellness area, so here we go. I know that we have all had challenges with coping in the unusual circumstances of COVID-19. This is especially true for parents who are faced with a decision around returning to school. I would like to spend some time with a guest today who has some excellent guidance for parents and their children. Please welcome Sangita Kamath.
Thank you so much, Lori, for inviting me to join you today. My name is Sangita Kamath, and I'm a clinical lead for the Child and Youth Team at Health Services. With many children returning to school this week, I'm here to suggest some ways we can mentally prepare ourselves and our kids for this new and very unique experience. As parents and caregivers, you know your child best, so feel free to adapt or modify these suggestions to best suit your child or youth's needs. I first just want to acknowledge that if you're feeling nervous and or overwhelmed thinking about the fall, you are not alone. In addition to making sense of everything that's happening and changing every day, you may have to explain it to your little ones. So just a reminder to be gentle on yourselves. We're living through some extraordinary times, but just know that we're here for you. Depending on where your child is going to school, they may be attending virtually, completing paper packages, going in person, or a combination of these options. Here are a few things to think about when preparing for school. During these times of uncertainty and unpredictability, knowledge is one of the most important tools to help us get through it. I would encourage all of us to make sure we have the correct and updated facts on COVID. The more we know, the more prepared we can be to protect ourselves and educate and protect our little ones. Public Health has regular updates that gives us reminders on how to keep ourselves and loved ones safe. Your schools may also send you regular updates or direct you to their website for more information. If you are able, talk to your child about how school will look different, whether they're learning at home or going in person. Children may not mention or say anything, but you bet it's on their mind. Children tend to mirror emotions of their parent or caregiver. It might be difficult, but try your best to stay positive, hopeful, and encouraging during these conversations. If attending in person and you have the information, let them know what school will look like. For example, desks might be far apart, there might be staggered breaks. Kids are probably seeing their friends after a long time. As difficult this might be, show your child how they can greet their friends in a fun way, maintaining distance as opposed to hugging or shaking hands. If you're learning at home, be prepared in the first few days to help your child with computer or paper package setup. For any questions, ask your teacher for strategies. I assure you there are no silly questions. Chances are, many parents and caregivers are wondering the same thing you are. Learning from home may mean children don't see their friends that often. See if there are any opportunities for your child to connect with peers and be social, whether virtually or talking on the phone. See if there are other parents or caregivers that are interested in maybe a social virtual call where children can talk to each other, show their drawings or anything that they built. Now, virtual learning may not be for everyone. If your child has a hard time with staying focused, here are a couple of things you can try. Give them a few simple activities to do while listening to their teacher. For example, doodling or coloring really helps me focus. You can also try beading, weaving, a simple puzzle, or fidget. For many of us, even if we're not looking at the screen or at the speaker, we're still listening. We may just need to keep our hands busy while the wheels in our brains are turning. Make sure there are breaks between activities. If your child is only able to stay engaged for, let's say, 15 minutes, give them a break close to 15 minutes. Now you must be wondering, how do I give my child breaks when I have so much to do myself? Try being strategic with planning your children's schedule. If you have a commitment, let's say at 11 a.m., see if you can schedule an activity for your child where they're a little more independent so you can accomplish your task. If you have a chance, build a child activity kit so that they can use these during their breaks. Also, if you have a chance to join them and take a break as well, hey, adults need breaks too. You can go outside for some fresh air or make a snack. Now, I've heard from a lot of parents that they are worried that their child might not be able to spend 310 minutes learning each day. To these parents, I would suggest focusing on enjoying learning and maintaining a positive relationship between you and your child more than getting stressed about keeping them focused all day. As children feel more comfortable and have positive experiences with learning, they might want to spend more time completing it. You can also gradually increase time as your child is able to tolerate the learning. Be prepared to spend a little more time in these next few weeks connecting with your teacher. What are the new expectations now that we're learning in a different way? What happens if my child needs more help? Set those clear steps at the beginning if you can. If you're feeling unsure and overwhelmed with using technology, please let your teachers know. This is new to everyone and it's okay to ask for help. Something that really helps children is establishing a routine. Kids do best when they know what to expect. Try to create a calendar to show your child what each day and maybe the entire week will look like. For example, keep snacks and lunches at the same time each day. You can also Google weekly calendars to see different formats that are used. When schedules are too open-ended, kids might feel a little unstable or a little more anxious. I think a good example of this is if you work shifts, like any shift work, it's like not knowing what shift you have until the day off. It's also a little more challenging for younger kids as they need more supervision, so keep in mind when building that calendar. This might be tricky, but try to find a space in your home that you have the least number of distractions and noise for learning. This could even be a quieter space within your dining room or living room, or a corner of your home that could be that child's space for learning. Now, it's been very difficult for adults. It's also been quite difficult for children to function through pandemic. Keep in mind that being off for many months, children will take some time to adjust to waking up early and sleeping on time. So it might take a few weeks to adjust back to the schedule. But after these few weeks, keep an eye on your children. If you notice any changes in eating habits or frequent butterflies in the stomach or more anxious kids, change in sleep routine, or your child has just been acting differently, take a few minutes to talk about their thoughts on returning to school. You can ask if they have any fears or worries. If not through talking, you can ask them to draw or maybe use Play-Doh to talk about school. If you would like some guidance, feel free to reach out to our team at 519-445-4983, or the Child and Youth Team at Health Services. Reassure your child that their teachers and parents will be there to help, and create that safe space so they'll be able to ask you questions. You can even come up with a couple of questions to ask your child each day to check in. For example, you can ask, how was the day? How can we make tomorrow better or easier? If your child is receiving support from healthcare providers, reach out to them to see how they can help throughout the year. For example, for a Child and Youth Team, you can call us at 519-445-4983 to learn more about the supports we offer. We're currently offering virtual and outdoor sessions, if appropriate. In the coming weeks, our team is looking to offer webinars and videos that could help your child. There's actually one next week called Ready, Set, Learn, intended for all caregivers. Our occupational therapists, Tanya and Vicky, will share strategies on successful learning at home. It's from 6:30 to 7:30 on September 16th. Please call or text 519-732-2928 to register. For those in virtual learning, even though your risks are lower staying at home, still practice hand washing and using hand sanitizers. When you leave the house, wear a mask, or you can even practice wearing a mask at home. Children will get into the habit of doing all of these when they do have to return to school. Since children are spending more time on devices, If your schedule permits, encourage your child to spend more time outdoors away from screens on weeknights and weekends. If there's anything your child or youth needs, please do not hesitate to call the Jordan's Principal Office. We're still working around the clock to support educational, social, or health needs. Please call or text us at 519-732-9831 or email curtismartin@sixnations.ca. That's Curtis with a K, URTISMARTIN @sixnations.ca. I just want to end by saying that the best way to teach your child about taking care is to be a role model, following safe practices, but also practicing self-care. Make sure you take breaks, get plenty of sleep, exercise, eat well, and stay socially connected. Thank you for taking the time to listen in today. During these very challenging times, I've noticed the resilience of countless families in the community. Please continue looking out for each other, taking care of each other. And I know it might be hard some days to continue staying positive, but I believe in us to get through it. Now,
Sangita, for joining us today. We certainly appreciate all the information you shared, and we hope our community maybe will put your thoughts into their actions. Stay safe. Now let's turn our attention to the numbers. Over the past week, the number of cases have been rising. That's right. Over the course of the last 7 days, the province has recorded new daily cases of over 150. Updating the current state in Ontario, we have 43,351 total cases of COVID reported. Of those, 39,077 have resolved, with 2,813 deaths. This means there are currently 1,461 active cases of COVID-19 in Ontario. Here at Six Nations, we remain at the report of a total of 16 cases. 15 have resolved with 1 death. Currently, we have 0 positive cases. Having a look at our testing numbers, 1,622 people have been tested, and of those, 1,554 are showing negative results. Oswego Public Health has directed 8 people into self-isolation. Now over to our adjacent communities. Mississaugas of the Credit remains at 1 case reported. Haldimand Norfolk Public Health Unit reports 481 total cases. 21 are active. 428 are recovered, with 32 deaths. The Brant Public Health Unit reports 167 total positive cases. 14 are active. 158 are resolved, and 5 deaths. The Hamilton Public Health Unit reports 992 total cases. 71 currently active. 876 are resolved, with 45 deaths. And the Toronto Public Health Unit is reporting 16,361 positive cases. 465 are currently active. 14,720 are resolved, with 1,176 deaths. At Six Nations, Project Protect Our People requires all of us to do our part. This means that upon your entrance to Six Nations, even if you are visiting for just a day, face masks must be worn in all public buildings. And there is a mandatory 14-day self-isolation for anyone crossing the U.S. border. Here's why self-isolation is crucial to our community. Self-isolation is when you have been told by Oswego Public Health to separate yourself from others, including the people you live with, to the greatest extent possible. Going into self-isolation is not meant to be a punishment. Rather, it's a precaution, as COVID-19 spreads easily from person to person. Why is it important? It's important. The most important reason is that you could have the virus without displaying any symptoms and infect others without knowing. Why else? Since there is not yet a cure for COVID-19, preventing it from coming into the community by self-isolating is one of the most effective ways to protect yourself and our community. When do we go into self-isolation? Well, when you return from travel outside Canada, if you have come into close contact with someone who traveled outside of Canada, if you have been diagnosed with COVID-19, or if you have been in contact with a probable or confirmed case of COVID-19 and you are waiting for the results of your COVID-19 test. Remember, the COVID-19 hotline remains open. Testing is available with an appointment on Monday, Wednesday, and Friday mornings. The Six Nations COVID-19 Assessment Center can be reached at 226-446-9909 or toll free at 1-855-977-7737. As you have heard in prior podcasts about the importance of contact tracing, we're announcing that there's a new contact tracing app available that is completely voluntary and collects no personal information. If you are interested, please visit the following website to find out more about this app. It's covid19.ontario.ca/COVID alert. You can also watch Healthy Six Nay and Six Nations Matters for ongoing updates to information and to programming being provided. The Fall Leisure Guide will be delivered out to the community very soon. Public Health would also like to remind everyone that they are ready to provide you and your children with immunizations and are preparing for this fall's flu clinics as well. Please call them at 519-445-2672 to schedule an appointment. And if you would like to connect with the Six Nations Mobile Crisis Services, you can do so by phone at 866-445-2204 or 519-445-2204, and that's available 24/7. You can reach them by text Monday to Friday, 8:30 to 4 p.m. at 226-777-9480, or by live chat Monday to Friday, 8:30 to 4, and that's found on the Six Nations Covid-19.ca website. Remember our frontline workers here on Six Nations and around the world. We are still in a pandemic. Please stay home for them. Please stay home for all of us. Stay well and stay safe. Nyala.